Okay. And Deanna, if you will kindly admit people while I do some introductions, I will so appreciate it. So it's so nice to be with you all this afternoon. I'm Mariel Risner Sibley. I look forward to meeting you. I'm new here. I've met some of you already. It's such a pleasure to be here as housing director. My background started out in law. I was with the Georgia Law Center for the Homeless, doing cases with clients who were all in meeting the HUD definition of homelessness. We did a lot of work with Social Security, a lot of work with families that were in shelters. I did family law there. I did wage cases and unemployment cases, and it was very interesting work. When I left that position, I later went to work for Atlanta Legal Aid, and they had a program called the Long Term Care Ombudsman's Program. And in that role, I had the opportunity to visit people in nursing homes, assisted living, group homes, and advocate for them, advocate on their behalf. And that position was with Atlanta Legal Aid. They had a contract for that work at the time. And from a colleague there, I learned about a position that was opening with a small nonprofit, a very entrepreneurial grassroots nonprofit called the Georgia Supportive Housing Association. And so I became the executive director of that 501c3. It actually was not a 501c3 at the time. We went on to apply for that status. And I began that work in 2016. And in that capacity, it was education and advocacy work primarily. And I also had the opportunity to learn about the development of supportive housing and the incredible need for housing programs, housing units across the state. So when I learned about the position here at St. Vincent de Paul, Georgia, it was really a blessing to be able to continue that work in a new capacity and move along, carrying along the education and advocacy piece, but also move towards creating some direct services and expanding the awesome Motel to Home program and working on creation of some other things that you all can put into place in the different areas that you're in, just looking at different programs and looking at expanding them. And the different areas of the state are different. So trying to be helpful in the different areas of the state. So I look forward to working with you and meeting you. And I'm glad you're able to join us this afternoon. So one of the things that I'm very pleased to be doing is supporting your work, supporting what you're already doing. And we know that a lot of the neighbors in need that you're meeting with are in need of health insurance or Medicaid. And so this is the first of just resource programs to connect you with professionals in this area who can help you when you're helping neighbors in need. And so it's my pleasure to introduce you with professionals from Georgians for a Healthy Future this afternoon. Um, they are an amazing 501c3 focused on all types of health education and advocacy issues. And this particular program that they have is the Navigator Program for Health Insurance. And so it's my absolute pleasure to introduce you to Deanna and Traylon. Deanna Williams is going to speak to us first. She is the Central Georgia Insurance Navigator for Georgians for a Healthy Future. In this role, she provides enrollment and outreach, specifically in the 10 counties that surround the city of Macon. She earned her BS in psychology and minor in sociology at Georgia Southern University. And following her passion to help others, she began her career at the DFACS, the Department of Family and Children Services in Bibb County, and later passed her CMS training to become a certified Medicare counselor for the state of Georgia. And we'll be hearing first from Deanna. But I also want to introduce you to Terrence Traylon Cooley, who we'll also be learning from today. He is a health insurance navigator focusing on Georgia's LGBTQ plus community for Georgians for a Healthy Future. In this role, Traylon provides enrollment and outreach in specific communities, including the LGBTQ plus community. He earned his Bachelor of Social Work from Austin, PA State University in Clarksville, Tennessee, and he later transitioned to Atlanta to obtain his Master of Public Administration from Troy University's cohort program. He has worked with diverse populations from at-risk youth to military veterans, and he brings a grassroots perspective to his work. He's deeply committed to developing a healthy rapport with all those he helps to serve and provide a voice for. And through his understanding of human behavior and the social determinants of health, he has made it his mission to advocate for equality for all, from education to healthcare. So it's my pleasure to introduce you to these experts who we can refer our neighbors in need to, and they're going to tell you a little bit about what needs that they serve and then how to refer to them. And then I'll also give some advice about how to refer to them. So I'm going to pass over to Deanna and spotlight her if that's okay.
Oh, hello. Well, good afternoon, everyone. I'm glad you all came and could join us today. And I'm Deanna Williams, and my co-host is Traylon Cooley. And we're going to start off by talking to you all so y'all can get to know us as the navigators. And I'm just going to close my video so we can just to focus on the presentation. So the navigator position was created by the Affordable Care Act to provide helpers for people to enroll in coverage through the health insurance exchange, and also to refer and assist them with Medicaid enrollment. So as a navigator, we serve as important roles in connecting communities that are historically experiencing lower access to health coverage, greater disparities in health outcomes to health coverage. And again, my main focus is the Middle Georgia area, but with Georgians for a Healthy Future, we cover all of Georgia, so we assist all of those throughout the state. Just to give you a little background, Georgians for a Healthy Future, we are what we consider the voice of Georgia health consumers. We are a consumer-focused policy and advocacy nonprofit that wants to make sure all Georgians have access to affordable and quality health care. As an insurance navigator, we provide free, unbiased information to assist consumers with making informed decisions regarding their healthcare coverage. Now, with Georgians for a Healthy Future, we are just more than navigators there. We also work with our coalition in building and mobilization, meaning we like to reach out to other nonprofit and other groups who have similar focus so that we can create one big group to provide services to all our Georgians. And we definitely participate in community outreach and engagement by going out to speaking out to different community events, whether it's a blood drive, a church functions, just being out in the community so that everyone knows that we're available, we're here to assist, and it is at no cost to you. A lot of our team does focus on the policy side, which they are able to see which laws and policies are about to come in place. And they like to advocate for those such as the Mental Health Parity Act. We were big advocates for that to make sure that mental health is taken just as serious as your other medical conditions. Why worry about health insurance? Health insurance is very important, and having health insurance makes it so much easier to get your doctor's appointment and other health services that'll help to protect you from unexpected medical bills. We all know this from this pandemic, and also with the monkeypox coming out of nowhere, it has highlighted how important it is to have health coverage. That's why we can encourage our partners to let the consumers know to get covered today and that there's help to get covered. We encourage them to take care of your health today so you can have that peace of mind of knowing you and your family are covered throughout the year. In ways that we focus on that, as navigators, we have a lot of things we focus on individually. Um, each year, the Center of Medicare and Medicaid Services, CMS, they make grant awards to organizations who serve as navigators in the federally funded states, excuse me. And navigators, we play a vital role in helping consumers prepare applications to establish their eligibility and enroll in coverage through the marketplace, or if they may qualify for Medicaid with the state. So since 2013, navigators have helped Americans understand their health insurance options and facilitate their enrollment in health coverage through the federally facilitated marketplace, also known as FFM. As a trusted community partners, our mission is to focus on assisting the uninsured and the underserved communities. Um, we like to make sure we do our outreach and reach those who otherwise may not know that they have this option. And sometimes it takes going into neighborhoods or places that you may not be familiar with or that you may not be used to, but taking a step beyond just going locally, but going into those communities to help those who actually need these services. And in order to act as a navigator, you do have to be federally licensed by CMS. And we go through a few trainings, both through the state, through the Department of Insurance, to make sure that we are qualified to assist individuals with enrolling in coverage. We start with assisting them also with the application or walking them through it or helping them to fill it out for those who may not be able to do it themselves. And we also educate them to let them know what's the process with the application and what does these abbreviations means if they see APTC, that's the annual premium tax credit. And we also help them if they feel they were denied for coverage, and we help them with filing an appeal to get that assistance. Other duties includes, like I said, engaging in the community. And this includes speaking with our churches, going to other nonprofits, going to schools in other areas that may need that assistance or just want that help, or someone that knows about the program who they can give a call and provide that knowledge. Um, with our education, we do this to raise awareness about the marketplace. A lot of people have this stigmatism and they hear Obamacare and they automatically have a negative notion about it. So we like to give them the new and updated information to let them know they may qualify for assistance plan for these plans, and your plan may not be as high or as may not be as high as you may have heard from your neighbor or some other person that goes through word of mouth. So as a navigator, we do operate year round to make sure we increase awareness among the remaining uninsured about the coverage options available to them, helping consumers find affordable coverage that meets their needs, and assisting consumers beyond the enrollment process. We make sure that we're equipped with the tools and resources to do that, because we all know that even though plans are available and they may not qualify for Medicaid, they may also need assistance with other programs, with organizations which some of you all may provide that may cover certain services for free or low cost to them if they are unable to get a plan. With the Affordable Care Act, which is the main purpose, which provides navigators, they had three primary goals in mind when the Affordable Care Act passed. It was to increase availability of health coverage, expand your options for buying coverage, and to make health insurance more affordable. And they do this through subsidies. The law provides consumers with subsidies, also known as premium tax credits, that lower the cost for households with incomes that are between 100% and 400% of the federal poverty limit. Now, the ACA also wanted to expand the Medicaid program to cover all adults with incomes below 138% of the federal poverty limit. But we all know not all states have expanded their Medicaid program. And unfortunately, Georgia is one of the states that has not expanded at this time. But also with Affordable Care Act, it does provide that protection against discrimination from insurance companies. And what that means is previously insurance companies may charge a person a higher premium because they have pre-existing conditions. The Affordable Care Act made it so they cannot be discriminated against and can still get a plan and not be charged more for that plan because of their condition. So we did have some new and improvements thanks to President Biden with the American Rescue Plan Act of 2021. And it did go into law as of March 11 of 2021. And it made major improvements to the access to and affordability of the health coverage through the marketplace. And the American Rescue Plan Act did this by increasing eligibility for financial assistance to help pay for their marketplace coverage. And the new law lowered premiums for most people who currently have a marketplace health plan. and it expanded the access to financial assistance for more consumers. We would like to give knowledge to the Inflation Reduction Act, which also has extended the American Rescue Plan subsidy enhancement so that people can still get those subsidies to help pay for their premiums. And those are for people who had received it 2022. It will still continue for 2023, and they say it is planned to extend out to 2025. So people still have that option to get help to pay for their premiums, and speaking with the navigator can definitely help direct you when you're looking at those plans. So some people like to ask themselves, are you eligible, or how do I know if a person is eligible for these plans? You are eligible to get a plan on the marketplace if you live in the United States, if you're a US citizen or lawfully present here, and you're not incarcerated. And they also want to let you know if you do not currently have any other type of affordable health insurance. A lot of people may not like the health insurance they have with their employer, but that does not give them, they can still get a plan on the marketplace, but they would not receive those subsidies to reduce the cost for them. Excuse me. So people who do not get health insurance at their jobs or do not qualify for public health insurance programs can get covered through the marketplace. And that's where the ACA comes in. Now, Georgia, we use the federally run health insurance exchange to enroll residents through healthcare.gov. This year, I'm sorry, this year, 11 carriers offer plans for 2022 coverage. And during open enrollment for 2022, Georgia enrolled over 700,000 Georgians in private individual market plans through the marketplace. So we're hoping that that coverage continues and that we can get more people covered this year because these subsidies will continue. So there are certain times of year when you can enroll, and coming right around the corner in 13 days, we have the health insurance marketplace open enrollment. And it will begin from November 1st of 2022 to January 15th of 2023. We also want to remind everyone to notify their consumers or clients you're helping of their very important dates. So if they want coverage to begin January 1st of 2023, they will need to be enrolled in by December 15th and have paid their first month premium. But if they miss that date, they have until January 15th to enroll, but that coverage will begin on February 1st. The health insurance marketplace has new plans and prices every year. So it's very important for people to explore your coverage options for 2023, whether or not they were previously enrolled before. Many consumers have also experienced changes in their incomes, especially due to the pandemic. So it's more important than ever that we encourage people to check and see if they qualify for these subsidies and compare plans today. Millions of consumers receive financial assistance to help lower their cost of insurance, and premiums subsidies will continue to keep the pace with the cost of the benchmark plans in their area. So last year, nearly 9 out of 10 people who enrolled through healthcare.gov qualified for financial help to make their coverage more affordable. We also encourage you, if you just are curious and you want to look and see what's available, you can visit healthcare.gov, or if you're in a different state, you can visit your state marketplace just to shop around and find plans that may work for the consumer. And that's how we use the tool to see what's best for them. In many locations, premiums have decreased for the 2023 plans. So we'd like to encourage you to be sure to send them to a navigator or a sister so we can explore those options for them. At this time, I do want to pass it over to my co-host, Traylene Cooley.
Thank you, Deanna. And good evening or good afternoon, everyone. My name is Traylon. I'll be taking the rest of the presentation over right here, and you will hear me from time to time say, next slide, please. And that will be so Deanna can go to the next slide for me. Now, Deanna has spoke with you all very specifically about some of the qualifiers, but most importantly, from a navigator's perspective, what our duties are, what our qualifications are, and why it's necessary to utilize our services. She's also now talked to you guys about open enrollment and So I'm going to begin talking to you all about special enrollment periods. Now we have open enrollment, which is annual, and it begins, excuse me, on November the 1st, as we've stated. After open enrollment has closed in January, those who have not enrolled by January usually have to wait until open enrollment again. However, there are some special qualifiers that allow you to circumvent that and can apply for the marketplace earlier based on situations. And those things are called special enrollment periods. So as we look here, there are several ways that you can begin to enroll in the marketplace outside of the open enrollment period if you qualify for a special enrollment period. And some of these qualifiers are listed as such: loss of coverage due to age, loss of job, or divorce. Sometimes we have different compositions in our families to happen, whether it's planned or unplanned. And when the composition of your family changes, so many other dynamics change, from your household income to your family size, whether it increases or decreases. And because of those situations, you may qualify for the marketplace, whereas before you didn't, based on your new circumstances. You can become married, whereas you were single before, or you can have a wonderful new addition to your family as you are beginning to grow your family with children. So there are many ways that you can qualify for a special enrollment period, which allows you to be able to actually apply for the insurance after the open enrollment period based on these qualifiers. Next slide, please. So there are 4 tiers of plans that are available for any individual who is seeking insurance through the marketplace. As you all can see by this visual, they are based on different price points as well. The lowest, or what I should say is the most affordable, or what has the low, excuse me, what has the lowest premium, is called the bronze plan. And basically what that means is, as we're looking at the plans, we're looking at how much the insurance company is going to pay and how much also a consumer will be required to pay out of pocket. If you look at the percentages on the diagram, on the bronze plan, 60% of the plan is covered, and you as a consumer or a policyholder would be responsible for 40% of that plan. And as you go up the tiers or the health insurance pyramid, you can see the plans begin to be covered more and more, which makes your out-of-pocket uh, cost and commitments change. And we can always talk with individuals specifically about where you qualify, what plan is best for you to choose based on the bronze, silver, gold, or platinum. There are many things to take into consideration when looking at these plan options, from the amount you make to your family size to the type of health concerns that you have that you would like to be covered, medications that are imperative that you have. So the plan looks at all of those types of things and considerations, and based on those needs and the conversation with the navigator, you're able to make the most informed decision about what plan will actually be the best fit for you based on your needs. Next slide, please. Now, the great thing about this plan, or about this type of insurance, is it is very focused on preventative care, truly believing that if something is addressed as initially as it can, or initially, if something is addressed as quickly as it possibly can, then that decreases the probability of it worsening or some other things happening as a result of that. So preventive care is very important, and the plans allow for certain things to be covered. As we're looking at this list, one of the first things that is very important is an annual physical. This is a service that is covered under the plan, which ensures that you're able to go to your physician, get a full health screening to determine what's working well, and also to maybe identify a couple of areas of need. And that way you can begin to address those types of things. Also, what is really great is that it covers women's wellness visits. Also, it covers blood pressure tests, mammograms, and HIV screenings, and it also covers tobacco use screens. So these are all services that adults are able to receive as a result of being able to have that insurance and having been approved by one of the plans. Next slide, please.
Jalen, you got a question in the chat of whether there are plans, ACA plans that come at zero premium for very low income people.
There are plans that are very, very cost effective, as close to zero as you can possibly get. I haven't personally seen any plans where there is zero financial commitment from the consumer as it relates to the plan. One of the things about marketplace insurance that many people sometimes don't know and or maybe are confused about is that the plan requires that you are an active participant in the payment and management of this plan. So being approved, there is an income requirement that every single person must meet in order to be approved for the insurance. Now, it differs based on family size and things of that sort, but you do have to have some type of documented income to be able to show that you'll be able to afford the premiums. Even though we are assisting with applying for and hopefully being approved to receive premium tax credits, there still will be some type of cost to the consumer as it relates to that premium. So I haven't seen any zero cost plans, but I have seen plans as low as $10. And if Deanna has, she can definitely speak to it, but I haven't personally seen any for zero cost.
Okay, yes, I can definitely speak to that. I have seen some that have premiums that have been as low as zero monthly premiums, but again, it was based on their income. What Traylene is saying is they have to have some type of income in order to fall in that perspective. So they can be fairly low just as an individual if their income is below, their income is at least at $12,800 annually, then they may qualify for a very low or zero out of $0 premium. But it just depends on the income and the number of dependents in the household. So it's hard to say whether they're just one you can choose from, but those are the two main factors, the income and the dependence in the household.
And actually, there's another question too in the chat of, are there choices for undocumented Georgians? And specifically in DeKalb County, but I think it's applicable across the state, the question.
Would you like to take that, Deanna?
I got you. So if they are undocumented, they are not eligible to buy marketplace health coverage. And they're not eligible for the premium tax credit and other savings on the market plan places, unfortunately.
And we can, this slide will be recorded, so you can always refer back to some of the qualifiers, as Deanna spoke about earlier, where you have to be a US citizen and not incarcerated, and some of those other things that will sort of give you a clear picture of what the minimum qualifiers are to ensure that you can possibly be approved for the insurance.
And also just a second notion on that statement, if there are some, like a family and the parents may be undocumented, then they can apply for coverage on behalf of their child or their dependents. So I want to clear that up. So they may not qualify for a plan, but if they have children, they may be able to get Medicaid or get a plan for them on the marketplace.
Next slide, please. Did that answer the question? I hope so.
Yeah, I'll let you know as more questions come into the chat.
Thank you.
Yeah.
Now, one of the great things about this coverage and selecting a plan through the marketplace is you have some things that are covered that may be challenged through mainstream insurance companies, or you may have a challenge with getting some of these things addressed. The bare minimum for all plans is that they must include coverage for these 10 essential health benefits. So any plan that anyone receives through the marketplace, these are the basic minimal 10 essential health benefits that will be covered, which is very, very good because many of these things on here are the common threads that people are having conversations on and or about as it relates to insurance. So many people who have pre-existing conditions become very anxious when maybe switching plans if you've already had insurance coverage for a long time and you're now having to go to a different company, wondering if I'm now going to be approved or how high will my premiums be based on me having a history of being treated for something for so long. So with these plans, having a pre-existing condition cannot rule you out of the coverage for a plan on the marketplace, which is great. Also, it addresses prescription drugs. It also helps regulate how much those out-of-pocket costs the consumer will incur are. And as you can see, there are 8 other benefits that are covered as well. But the key is that any plan on the marketplace is going to ensure that these 10 essential health benefits are going to always be guaranteed with whatever plan that you choose, which is wonderful and comforting to know. Next slide, please. Who gets Medicaid in Georgia? Why are we talking about Medicaid if we're talking about ACA insurance? The great thing about the marketplace is the way it's set up, it wants to ensure that you have some type of insurance option. So as people go through the application process for a marketplace plan, if for whatever reason one may not qualify, then if there are other options available, then one will be prompted to explore those other options. And Medicaid is one of those options. Not being able to qualify for a marketplace plan may simply mean a few things. Um, Maybe I don't have any income at all. Maybe the income that I have is too much for me to qualify for a plan that I feel the premiums are affordable. If for some reason you are not approved for a plan and it's possible that you qualify for Medicaid, then through the application process, one will automatically be prompted to apply for Medicaid as certain questions are answered and it's determined that it looks as if one is more eligible for Medicaid. If your income is low and you match also one of the listed criteria, you may be pregnant, or parent or caretaker of a child, teenager specifically under 19 years of old, 19 years of age. Also, if you are 65 years or older, legally blind, have a disability, these things may cause you to qualify for Medicaid, which is going to be also an insurance that's going to ensure that those 10 essential benefits are also provided through your insurance coverage. And it's going to make sure that you have a comprehensive plan that will allow you to be able to address any and hopefully all medical needs that you may possibly have. This is for individuals as well as families in some cases. Next slide, please. Georgia's health insurance coverage gap. What does this really mean? This visual is so descriptive and it says so much without saying a whole lot. We have what we call the coverage gap, which simply means, in a nutshell, I make too much to qualify for the marketplace insurance, but I don't quite have the income that qualifies me for Medicaid as well. Many people fall in what we call that coverage gap. And for some reason, that means at this point, these individuals are having a very big challenge with discover or finding what can assist them when it comes to health coverage needs. Right now, we have over 430,000 uninsured low-income Georgians. They don't qualify for Medicaid or earn enough to help with the marketplace insurance plans. And that has been one of the reasons that the push for the expansion of Medicaid has been so paramount and so visible in many of our conversations and presentations, is because we want to be able to actually close this coverage gap and consider those working class individuals who are definitely trying to make a living. And it seems as if they are being penalized for trying to survive. And one of those penalties is making too much or not making enough, which keeps you not qualifying for either option. And so we want to be able to have more conversation about that to figure out the best way to address things, which we are right now supporting the expansion of Medicaid so we can hopefully close this insurance coverage gap.
And Jalen, I'm going to pause you right there. And so there's another question in the chat for you or Deanna about, are you able to advise clients if the plan that they're getting is accepted by the hospital or clinic that they want to go to? Or if they're getting Medicaid, are you able to give advice about who will take Medicaid?
We are definitely able to look at carriers who accept those policies, yes.
Awesome.
So
And
as we're going through the application process, we ask a series of probing questions, things that are important to a person who's being insured. Are there any specific medications that you are on now that your current plan is covering and you want to ensure that this medication is covered? So we try to look that up and determine which plans are best based on the coverage needs for that specific medication. Or it may be a pre-existing condition or what have you. So we are able to, or you may have a simple preferred provider that you've been with for so long and they know so much of your health history that you feel most comfortable with them and would be very disheartened if you had to change. So we also look up all of those things to determine what's going to be the most comfortable for you to make that decision. So yes, we're able to look up certain providers, locations, medications, and also health needs that you want to ensure that there will be some type of coverage for as well.
thank you.
Next slide, please. If you are uninsured and in Georgia's coverage gap, ask us about how you can find ways to get insurance or to get your health needs met. One of the ways that we are an advocate for equitable health coverage for all Georgians is collecting stories from people who have had a challenge with being insured, who may have fallen in the coverage gap, uh, who may have been denied insurance for whatever reasons, or just individuals who want to get their experiences out so other people will not maybe necessarily have those experiences or can prepare for those experiences. We do it through story collection. We ask people to tell us your story. It can be anonymous, or you can be as very identifiable as possible. And the software that we use allows you to record it visually um, or just verbally. And as we are able to collect these stories in our efforts to advocate for various legislation or to support anything that's going to make it easier for Georgians to gain health care, we also use these stories as support to show that whenever we're supporting something, you're hearing this directly from consumers who were directly affected. You're hearing this from individuals who have dealt with whatever the situations were, and these were the outcomes, and they want to be able to share those experiences, whether they were positive or challenging. And we make sure that we provide the voice of the people to whomever we're talking to. So it's not only just coming from us. So story collection is very important, and it allows us to also basically just hear experiences from the lens of the individual who had undergone those experiences, which um, sometimes sometimes the stories are so mind-blowing that you can't fathom why someone would have these situations to go on, but we don't necessarily think about those things all the time, or have even maybe encountered individuals that have so many struggles as it relates to insurance. So story collection is very important. We take it seriously and we use it to simply provide an additional and authentic voice to the advocacy work that we do. So if you ever have a story that you would like to share, whether it be a motivational one or whether it be one of caution or just simply information, click on our website, go to the specific link that asks you to tell your story or share your story, and begin to talk about your experiences. We would greatly appreciate that. Next slide. And here we are. If you are interested in having a specific conversation with either of us about your chances to apply for the marketplace insurance, then we encourage you to contact us via phone or via email.
Actually, I'm going to step in for 1 second because we're actually going to put a button on the member website. And so you can directly refer clients through the St. Vincent de Paul, Georgia website. So take down their contact information for when you have extra special questions and you want an advocate to help you. These are those advocates' phone numbers, so you can have a direct line to them. But we want to collect data from St. Vincent de Paul, Georgia about our referrals, so we know how many people are using this service. So we can just kind of understand better what the need is. And so we're going to be putting we're going to be putting a button on the member website, and on that form, it will ask for your neighbor's contact information for Traylon and Deanna to be able to reach out to them directly. And it's going to ask a question such as, why are you connecting them with health insurance help? Is it for Medicaid? Is it for a policy on the exchange? It's going to ask a question, and then it's going to ask for your contact information. It's going to say, how did you hear about Georgians for a Healthy Future? And there's going to be an option that says, I'm a St. Vincent de Paul, Georgia caseworker. And then it's going to ask for your contact information. And that's important for us to know about the need that you're seeing. It's important data for us to have. So yes, reach out to them directly with inquiries and questions. But when you refer a neighbor, use the website link. And we will share that link in an email that will go out to everybody. So there's some awesome questions in the chat, and I misqualified an earlier question. My apology for that. The question was not if they qualify for a policy on the exchange. The question was, if someone is undocumented, do you know referrals for resources where they can get professional health care? And then there's some other questions.
Oh, okay. Yes, so one of the Grady is so paramount in a lot of things here in Georgia. Um, so yes, there are what we call sliding scale fee insurance options for individuals who don't have insurance, but um, who are also undocumented. At no point, at no point should anyone be forced to not have to address their health needs based on certain restrictions. And so one of the places that usually tries its best to give healthcare options to as many people as it can is Mercy Care. They have a location on Decatur Street, close to downtown. It's very rare that I've heard that anyone is turned away from there, and they're more concerned with seeing how they can provide you some help as opposed to trying to gauge your citizenship. So that's one resource that really tries to help anyone.
And maybe what we can do is in the email, maybe I can help put together a resource list um, with Traylon and Deanna's help, and maybe some other resources for folks who wouldn't qualify for these. So I'll make a note to do that and look for some statewide resources.
Also, Grady. Yes, Good Samaritan is another one. Very, very good. So there are other options, and we could have those specific conversations with you all and try to help guide you in the right direction. Many times when this presentation or this specific group of slides is introduced to people, they always want to ask a lot of times, well, tell me, let's talk more about the income and how do I qualify? And the reason that many of our presentations, especially to crowds like this, are very generic is because marketplace insurance is very specific and it's customized to the individual or the individual family's needs. So it's challenging for us to answer very specific questions surrounding income, surrounding pre-existing, well, not if you income, but also if something is covered with a certain provider, we have to look those things up because it really evaluates you on an individual basis. So when people have very specific questions, those require appointment times and one-on-one discussions with us as navigators to help you with those. So we try to provide the basic general information, and we do hope that this has given you at least a little clarity on some things that you may have been confused about or didn't know, or just point you in the right direction to get those questions answered. So if we didn't provide as specific information as some people were maybe hoping for, it's for that reason. But we can have those individual conversations with you. We can look at the specific family composition, makeup needs, and then we're able to have a more focused conversation about in reference to who can be helped and how we can help.
So when someone puts a referral on the member website and it gets sent to you, what is the turnaround time for you to reach out to the client? Because the caseworker is not the person who you're going to reach out to. You're going to reach out right to the neighbor in need. So what is generally that turnaround time from when you receive that form?
Up to 48 hours. We try to respond quicker, but our policy states give us at least 48 hours to get in contact with you because we want to ensure everyone has that specialized personal time that they all need and deserve. So with it just being us and so many people having a need for a conversation surrounding this to determine if they even want to pursue it, we can be quite swamped. And so we ask that you give us at least about 48 hours to get back to you so we can ensure that we have some time allotted to answer your questions and help you walk through the application or any other things that you may need.
And just to piggyback off of Trayland, I have noticed in some cases, some people are in emergency situations. Well, they may have found out they were diagnosed with cancer or something. If it's someone who you are having a specific problem with and they need coverage immediately, please feel free to reach directly out to us so we can know that client's name and go ahead and start working on their case because we know how time consuming it can be and we want to help them as fast as we can.
And so when it comes down to whether someone's going to qualify for Medicaid or for the exchange, should the caseworker do anything specific or just send them to you for you to figure that out?
We love preparation, but if you could just need to send them to us as they are, that's fine. But some of the things that can be helpful in situations like this or trying to expedite a process is to ensure that those basic documents that are needed for the application have already been gathered. Some type of form of identification. How do you document what your income is? We're going to need to verify family size and family composition. So those types of identifying documents could be very helpful in the process because many documents also have to be uploaded to the exchange. So just that type of pre-planning work would be so great in the application process. And also just preparing the neighbor um, for the prepare the neighbor to understand that this is a process that may take some time when it comes to filling out the application based on how many people in your family there are. And it can seem a little intrusive, and some people become very uncomfortable with some of the questions that I ask because even though it may not be someone necessarily applying for the coverage themselves, the application may still ask questions about your entire family household composition, and it may ask specific questions about those individuals who haven't been identified as applying for the insurance to take into consideration to make the determination. So just understanding that it's going to be what some would consider an intrusive or very intense process as it relates to trying to gather information, but it's all to make um, the best determination to get you the best qualified plan that they possibly can.
Wonderful. And so there's a question about the Grady card. So if we're referring someone to Grady, can you explain what a Grady card is? And the question is, are there specific instructions for clients to obtain and maintain Grady cards?
As best I can, I will describe it. I don't work for Grady, but from my experience, having the process of getting a Grady card is going directly to financial services and telling them that you would like to be assessed for financial hardship or some type of financial assistance plan. And basically, that's what it is. You'll sit down with the financial counselor. They have a series of questions that they ask you, and based on your answers, that determines if you qualify for some type of um, financial assistance program that they have through Grady. The reason it's called a Grady card is because it's specific to Grady. It's not health insurance. It's just a discounted um, service service plan for that individual, if you will. And everyone's assistance amount may be different. So you'll see the financial planner. They'll make a determination based on the information requested, and you verify those things. And once you're awarded a Grady card, it may simply mean now that you're only responsible for a certain percentage of out-of-pocket costs when receiving services from there. Some as low as 5% to high as 5% or higher. I'll say that. But it's just a service through Grady specific for their services that has evaluated you and determined that based on your need, you were not able to pay the full price for services, but this is what your documents show that you're able to afford. Does that make sense? Or I hope
It
I tried to
does.
explain it to the best of my knowledge that I could.
It
Deanna,
does.
would you like to weigh in?
No, you have it all correct. I was about to share the link where we all talked about the barriers to care at Grady, which gives you the information about the Grady card. Because for some of their financial assistance, you have to be residents of DeKalb and Fulton County.
Mm.
But I will share the link in the chat.
That would be great. Thank you so much. Thank you. Does anybody else want to put a question in the chat or pop in onto the screen and ask a question? I really appreciate you joining us today and teaching us about this and the work that you do. And it's so great to have experts as a resource for neighbors and potentially for questions that we have ourselves that you might be helpful to. So thank you for that.
No problem. Let me say one other thing too. Okay, let's be honest here. We know that people talk. Um, whether it's a good thing, people want to share it. Whether it's a not so good thing, people want to share it. So there are so many myths out here about the marketplace insurance. And one of the biggest conversations is usually, oh my gosh, those premiums are not affordable. I don't know what they're thinking. That is why the annual premium tax credits are so important. Many people have probably tried to apply for a marketplace plan on their own just by going to the website, and not necessarily having the tools needed to navigate through it properly, or may not understand some language. And after having completed the application, it shows that your premium is, $600 or something a month, which is astronomical. And it may simply be because there was something missed on the application or not completed right. And if we're able to figure those things out and see that you do qualify for a annual premium tax credit, that will reduce your premiums tremendously. So just because someone applies for a plan and automatically sees a high premium, it doesn't mean that those premiums can't be offset by premium tax credits. And so I've heard so many people say, there's no need to apply. Don't waste your time. I'll say in reference to how healthy you can be, always take a chance on trying something to better your own health. And many people have qualified for the marketplace plans and received premium tax credit reductions, and were amazed at how they are now able to afford insurance and go to their doctor. So even if there are high premiums, there are ways to circumvent those with those annual premium tax credits.
Thank you, thank you, thank you. And I'm going back and I'm capturing these links for our email. So I want to thank you for sharing your time and this knowledge. Um, let's see, there's another comment here too. Okay, that's from you, Deanna. Okay, thank you so much. And we got you at just the right time before open enrollment. So thank you again for joining us today, and also for the partnership with us to be able to refer to you. Thank you for that.
You're
Um,
welcome.
so
You are
appreciate it.
welcome. Thank you for allowing us to come and speak. We really appreciate that.
Yeah, well, I know I'm speaking on behalf of all of us that we look forward to working with you and appreciate your help for our future referrals. So on that note, it's 1:01. I hope everyone has a wonderful rest of the day, and look out for our email with the referral link and these links, and ideally a resource list too. So thank you all.
Thank you, Alan. Have a great one.
You
Thank
too.
you. Y'all have a great day.
Thank you.